presentation on communication strategies critical for patient safety. My name's Lauren.
I'm Chloe. I'm Kaveri.
I'm Rachel. I'm Lexi. Effective communication in nursing is vital for delivering high-quality patient care. It serves as the foundation for building trust, ensuring patient safety, and fostering teamwork among healthcare professionals.
This presentation will explore key communication strategies like SBAR, timeout, universal protocol, handoff, and bedside shift report that help nurses convey information clearly, reduce errors, and improve patient outcomes. By mastering these skills, nurses can enhance collaboration, advocate for patients, and contribute to a more efficient and compassionate healthcare environment.
Okay, first up we have Team Steps. Team Steps stands for Team Strategies and Tools to Enhance Performance and Patient Safety. Okay, overview / explanation of Team Steps. I got this right off the site. It explains it wonderfully because it's a little confusing, so stay with me. Team Steps is an evidence-based framework to optimize team performance across the healthcare delivery system. It requires clearly defined and appropriate team structure and the use of 4 teachable, learnable skills. Those being communication, team leadership, situation monitoring, and mutual support. The Team Steps framework reflects the connections between these 4 skills and how they contribute to the knowledge, attitudes, and sustained high performance needed to achieve highly reliable, safe, and effective care for every patient. Okay, so here's a nice little diagram to kind of explain Team Steps. So the reason we have Team Steps first is because Team Steps is kind of like an umbrella, and underneath it includes all the other more specific forms of communication that we're going to talk about later in this presentation. So the 4 categories that are involved in Team Steps are communication, leading teams, situation monitoring, and mutual support. There's a little description about all of those. And so under these 4 categories, next slide. So communication, for example, SBAR report, call out, check back, handoff. Leading teams, we have brief, we have huddle, and we have debrief. Situation monitoring, we have STEP, cross monitoring, and the I'm Safe checklist. And mutual support, we have 2 challenge rule, CUS, and DESC script, desk script. Okay, so the origin of Team Steps. It originated from research and efforts by the Department of Defense in collaboration with the Agency for Healthcare Research and Quality. The program was officially developed in the early 2000s as a response to the growing need for improved communication and teamwork in the healthcare setting to enhance patient safety. The importance of Team Steps. Team Steps is crucial in healthcare as it provides a framework to improve communication, teamwork, and patient safety. So, as I mentioned before, this basically just gives an outline of how to implement things to promote better communication, like those examples that I gave earlier. So, it's more of a framework to implement those things rather than a specific type of safe communication. By promoting clear communication, collaboration, situational awareness, and mutual support, it helps to reduce medical errors and enhances patient outcomes. The program fosters a culture of safety, strength, leadership, and empowers team members to address concerns effectively. That's also something that's a little bit different, is it also then focuses on the medical team also and their communication and their safety and how they're doing, not just like protecting the patient and wanting to take care of the patient. Also focuses on the healthcare team. It is adaptable. Its adaptable nature allows it to be applied in various healthcare settings, ultimately improving care quality and efficiency. Okay, this is just a screenshot right from the website that outlines more of its importance. So positive change in behaviors. These kind of talk about some of the studies that they did and the results from that. It increased patient satisfaction, it improved outcomes, cost savings, process efficiencies, and lastly, enhanced staff satisfaction. So what is the role of the nurse in safe communication? We'll go in depth more about specific types of communication later on in the role of the nurse, but this is kind of a brief overview in the role of the nurse in specifically the framework that is Team Steps. So communication, use tools like SBAR to accurately share patient information with the team. Leadership, coordinate care, facilitate briefings, and lead discussions to improve care plans, mutual support, assist team members, and use strategies like CUS to voice safety concerns. Situation monitoring, maintain situational awareness to anticipate and address potential issues, and advocacy and conflict resolution, advocate for the patient's safety and resolve team conflicts effectively.
Okay, next we have SBAR. So SBAR is situation, background assessment, and requests or recommendations.
Okay, for situation, first the speaker presents the situation by identifying him or herself, stating the patient's name and briefly describing the problem. What is going on with the patient, and what is the situation you are calling/communicating about?
So for background, the speaker then provides the background of the patient, such as their diagnosis, their reason for admission, their medical status, and any relevant history. And then the patient's chart is reviewed so that questions the other care provider may have are anticipated. What is the background or context on this patient?
Okay, so then for the assessment part of SBAR, any specific information regarding the patient's vitals or recent lab results related to the patient's current state are communicated. And this section can also include a provisional diagnosis or clinical impression. So this is pretty much just saying what is the problem?
Okay, so for recommendation, it is an informed suggestion for the continued care of the patient. It has to be made by the speaker. The immediate need is explained clearly and specifically, including what is necessary to address the problem. So what is the next step of management in your patient?
So SBAR was traced all the way back, used in the Navy and nuclear submarine operations in high stakes, high stress environments. And then it was adopted into healthcare formally in the 1990s.
So SBAR is an important communication tool for nurses just to make sure that information is conveyed clearly and effectively to other members of the healthcare team, just to ensure safety of the patient and to make sure that you're getting the point across.
Okay, so what is the role of the nurse in SBAR? Ensuring accuracy of the information, be concise, but make sure all the important information is there. Use straightforward language so the receiver understands. Accurately document the communication and follow up if necessary. Now we have an example of a good SBAR and a bad SBAR.
Guys, do you even know how to call the doctor?
Hey, this is Dr. Smith.
Hi, Dr. Rhodes. I'm calling about Mr. Smith in 210. She doesn't look very good. I think she came in here a few days ago for pneumonia or something, and she has, or maybe COPD, I can't remember. She's been breathing and her O2 doesn't look too good, but I haven't got her vitals yet, but she just looks kind of sad and sick. I don't really know. Anyways, I'm not really sure what to do, so maybe you could help out.
Okay, I need way more information. What exactly is her oxygen saturation? And have you checked her vitals? How long has she been experiencing this? Have you increased her oxygen? Because if you haven't, you need to. Please gather her most recent vitals, respiratory rate, blood pressure, and...
This seems like a lot. I'm just gonna call her up and... Somebody get the crash cart!
I mean, honestly, I don't know what they're teaching in nursing school, but that was the worst SBAR I have ever received.
I don't know why the doctor was so upset. The patient ended up living.
Hey, this is Dr. Smith.
Hi, Dr. Smith. This is Chloe, the nurse taking care of Mrs. Green in room 210. I'm just calling because she's been experiencing increased shortness of breath and her oxygen saturation levels have dropped. She is a 68-year-old female admitted 3 days ago with pneumonia. She does have a history of COPD, and her oxygen requirements have been pretty stable on 2 liters. However, in the last 2 hours, her O2 sat has dropped to 88, and she's now on 4 liters. Her respiratory rate is 28, and she appears more fatigued and anxious. Lung sounds are diminished bilaterally with coarse crackles in the bases. Her blood pressure currently is 130/80, heart rate is 105, and temperature is 99.2. I think we need to increase her oxygen support and possibly consider a chest x-ray or ABG. Would you like to increase her oxygen or run any additional tests?
Thanks for the detailed update, Chloe. Let's increase her oxygen to 6 liters for now and definitely order a chest x-ray. I also want to get an ABG to check her CO2 levels. Please just monitor her closely and definitely let me know if her respiratory status worsens or if there are any other changes. I'll come to assess her as soon as possible and I'll put those orders in right now.
Okay, bye.
All right, next we have universal protocol. So this involves conducting a pre-procedure verification process. You want to make sure it's the correct patient, site, and procedure, and mark the site. This prevents the wrong patient, wrong site, and wrong procedure, and then we can begin the timeout. It was established by Joint Commission in 2004, and it was established by Joint Commission in 2004, and it continues to evolve every day to enhance effectiveness. So it's important. It prevents errors, enhances communication, enhances the quality of care, and it's the standardization of practice. Okay, what is the role of the nurse in safe communication? The nurse is responsible for ensuring that the pre-procedure verification is started. So they're going to mark the patient, ensure all the documents and information is correct, and get everyone on the same page so that when timeout rolls around, they have all the information. Here is a good and bad example of universal protocol.
Okay, Lauren, how are you feeling about this nose job?
I'm so excited, but I'm just kind of nervous. I've never had anything done on my face.
Alrighty, Jackie, you ready to get those hunkers downsized?
Doc, this is Lauren, and she's actually here for the nose job.
Oh, that's my bad, sweetie.
He's literally always embarrassing me in front of our patients. Freaking hate it when he doesn't take his meds.
What can I say? Mistakes happen.
I'm actually kind of glad he got them confused because I got new boobs and a new nose.
Hello there, Lauren. Nice to see you again.
It's nice to see you.
Are you ready? Are you ready for this nose job? How you feeling?
I'm ready. Let's do it.
Okay, next we're going to talk about timeout. So timeout is a standardized safety practice designed to prevent serious errors during surgical or invasive procedures. It's an intentional pause taken by the entire surgical team just before starting the procedure to confirm critical information and ensure that everything is correct. It prevents wrong site, wrong procedure, and wrong person surgery. Okay, the origin of the timeout was originated from the need to enhance patient safety during surgical and invasive procedures. It was introduced as part of the Universal Protocol by the Joint Commission in 2004 as a way to create a systemic approach to patient safety. Okay, and timeouts are important for preventing medical errors, confirming consent, identifying patient-specific risks, and limiting distractions. Okay. The nurse role in timeout is, nurses are often the facilitators of the timeout process, so we play a crucial role in team communication and identifying potential risks. We highlight these risks and discuss them during the timeout to ensure that the team is fully aligned and planned with planned patient safety interventions throughout the procedure. Okay, so now we have a good and a bad example of timeouts.
All right, Doc, she's prepped. We're an hour behind. Are you ready?
Just like one more second.
I don't even know why she's so obsessed with herself. Half her face is fake. All right, are we ready for timeout?
Oh no, I don't have time. I have a lunch date.
Okay.
I could have sworn she had a husband and kids, and last I heard, her husband was deployed. So, who is she going out with? 10 Blade.
Hey, I'm here to break you for lunch.
Okay, sweet.
This is just a left leg amputation.
Yep, left leg
Okay,
amputation.
how's it going so far?
Pretty good.
Pretty good. Anything I need to know?
Nope.
Hey, sounds good. Wait, that looks like the right leg to me. Guys, it's supposed to be the left leg.
I knew this was gonna happen.
All I gotta say is I'm glad I wasn't in there to start out with. They got themselves in some deep doo-doo, but I was the hero, but I always am, so.
Well, that's not my fault.
Well, if we would have had the timeout. I can't wait to write her up.
Done with this place. Yeah, I don't even know. Like, what do they want me to do? I'm literally just a girl.
Yeah, so I mean, I don't know. I was just like resting with my eyes taped shut and I just was sleeping so good and it seemed like it went well. But when I got back to the recovery room, I had like stitches on both legs and I have no idea why.
All right, you guys ready to do some surgery?
We're ready for timeout.
All right, go ahead.
All right, Dr. Rhodes, this is Lauren. She's here for her left leg amputation, no known allergies. Her consent forms are signed and all of her pre-operation medications have been given.
Okay, perfect. I met with her earlier and got consent, so we're ready to go. I got the left leg prepped.
Okay, so next we're going to talk about handoff, which is basically at the end of your shift when you hand off your patients to the next nurse. Okay, so an effective handoff should include identification of the patient, so their name, age, diagnosis, relevant history, their current status, and any changes in their condition over your shift. Their vital signs, so any trends that you've been seeing, anything that's concerning, definitely. Their care plan, like any of their treatment plans, nursing interventions that they should be doing or you have done, and then any specific tasks planned or completed. Definitely want to pass off critical issues, so any concerns that require immediate attention. And then also it's a chance to talk about their individual needs. So this is when like patient-centered care comes into play. So you might talk about their patient and family preferences, any expressed concerns or requests, and then any social or psychological factors that they need to be aware of. So handoff report has been around for a really long time, but in the last 25 years, it's really been refined and standardized just to really promote patient safety and quality improvement. The Joint Commission stated that poor communication is a contributing factor in more than 60% of hospital adverse events. So it's super important that we're giving good handoff, that it's accurate, and that we're communicating clearly just to keep our patients safe. We kind of already talked about this, but the importance of handoff obviously includes patient safety, enhanced coordination of care, continuity of care, and then individualized care, so like those special considerations that we were talking about. And then obviously the nurse's role in safe communication is giving accurate and complete information, so give a good report that's thorough and gives all the details that they need. It's not a time to gossip or give irrelevant information. And then definitely promoting patient safety, highlight any big concerns on the patient. Like if the next person needs to know that in order to keep them safe, then you need to include that in your report. And then you can also involve the patient and the family in the process, and then it's also an opportunity for safety checks. Here's an example of a good handoff report and a really bad handoff report.
Oh yeah.
Okay,
That's me.
I think I'm getting a report from you. I'll just
Oh, okay.
sit
Okay.
kind of.
What rooms you got?
58 through 64.
Oh, okay. Yeah, I have 58. Okay. Let's get started.
Okay.
How you been?
Good.
You're looking good.
I don't know what his problem is, but this is not the first time he's hit on me.
What do you want me to do? She's a babe. Okay. Anyways. Yeah. So, 58's gonna have to be Mr. Johnson. He came in yesterday, some kind of heart issue. You know. Maybe it was chest pain. Not entirely sure, but you can just look that up. So I didn't really read the admission note. I didn't think it was like very important. But he's been pretty quiet all shift. So at one point, like the tech told me he was in pain or something. But like I went in there, and he was fine. So, you know, I just left it like that. Anyways, so his blood pressure was like 75 over, over 32. So I gave him like a sip of water, and he says he feels fine. So, yeah, he's good. He's so good. He's gonna be so good for you tonight.
Is he dead?
No, he's good. Yeah, the tech has been in there, so.
Maybe, I'm just gonna go check on him really quick. So
No,
just, like,
let's finish this up. I got a date. I got a date to be at. Come on, let's go. Anyway, so I don't think he's allergic
I'll just be right back.
to
You keep going.
anything. Okay, have a good night.
Hey, Chad, right?
Oh yeah, Kaveri, how are you doing?
Oh, I'm good. How are you?
I'm good. You have some of my patients?
Yes, let's do it.
Okay, awesome. Where do you start at? What room?
58.
58, perfect. Me too.
Okay.
Okay, in 58, we have Mr. Smith. He is a 68-year-old male, admitted yesterday for chest pain. He does have a history of coronary artery disease and hypertension, and he treats both of those with medication at home, and we're continuing those here in the hospital. Cardiology is following his case. EKG is looking good. He's running sinus rhythm in the 70s. And troponins were negative when he came in. So more of just monitoring. And we have a stress test scheduled for tomorrow morning. It's kind of the plan for him. Vitals have been stable throughout the day. Oxygen's great on room air, starting at 97. Pain-wise, he's doing a lot better. He does have 650 milligrams of Tylenol as needed. We did that once this morning when he had a little bit of pain, but he's been good since then. No other issues anywhere else. Abdomen soft, non-tender. He's had good intake and output. We've been monitoring that just with the urinal at the bedside. No problems with the skin, intact. No pressure injuries. We do have a pup on his sacrum just for prevention. Let's see. No known medical allergies, so we're good there. Plan is just to monitor and then NPO after midnight. He has a right AC and that is just saline locked. To get up, he's like one to stand by with a walker. He moves fairly well, but we've just been using the urinal in the bed, so that's worked out good. Other than that, do you have any questions for me?
No, I think you covered everything.
Okay, sweet, let's go meet him.
All right. Okay, so next I'm going to talk about bedside shift report. So bedside shift report is when the outgoing and oncoming nurse give report at the patient's bedside at shift change. This involves discussing the patient's status, care plan, changes, and any concerns directly with the oncoming nurse and the patient and any family members that may be present. Bedside shift report has been shown to decrease sentinel events, medical errors, patient anxiety, and report time, and improve nurse-to-nurse and nurse-to-patient communication as well as patient satisfaction. So this is all that should be included in your bedside shift report. It's kind of the same just as handoff, but the introduction, so usually the outgoing nurse will introduce the oncoming nurse to the patient, and then you provide situation, background, assessment, and this is where you could check that like side rolls are up, bed alarms are on, you trace your lines, any clutter that might be in the room, checking drips, fluids, whatever. And then any recommendations or like pertinent information for the care plan, and then thank the patient, ask them if they have any questions or anything they'd like to add. So bedside shift report originated in the 1990s and early 2000s. Institute for Healthcare Improvement, Joint Commission, and American Nurses Association all push for bedside shift report to reduce communication errors, increase patient engagement, and improve overall safety. So the importance of bedside shift report is patient safety. It's been found to decrease falls, and also the last known well of your patient could be at shift change while doing bedside shift report. It also is good for nurse accountability, so consistency of your assessment with what was given in report. Sometimes there can be inconsistencies there, and so it holds the previous nurse accountable for telling you the right things. And then also the patient or room not being left disheveled by the previous nurse, because you both are going in there together. So they want to make sure everything looks good. And then also patient satisfaction scores, including patients in bedside shift report, supports patient-centered care, and the patients will feel more included in their care. So the role of the nurse in bedside shift report is facilitating critical patient information, engaging the patient and any family members that might be present, and allowing them to be a part of the conversation, reviewing the care plan with the oncoming nurse and the patient, conducting safety checks, so checking lines, drips, infusions, and then clarifying any questions that the patient or oncoming nurse might have. So here's an example of a good and a bad bedside shift report.
So the next one, 402, is Mr. Smith, and we are not going in there. I've had the worst day with him, and I'm just gonna let him sleep. So let's
I'm
move
good
on.
with that. Mr. Smith? Mr. Smith, not the ceiling again! I'm literally always gonna do bedside shift report because the patient was a freaking mess and there was IV fluids just running onto the ground, and like, what the heck? Good way to start off the shift.
Bless his heart. He's always climbing up the walls at home.
Okay, are you ready to go meet Mr. Smith?
Yeah.
Okay. Hi, Mr. Smith. Oh no, not again.
I'm trying to get out of this place.
Bless his heart. He's always climbing up the walls at home.
Oh dear. Mr. Smith.
Mr. Smith.
Let's get down.
Let's get down.
Come here. Come on. Sit down, please. Okay, Mr. Smith. I'm so glad that we both came in here to do a bedside report
I
so that
know.
we saw that he was unsafe. Okay, so I'm just going to tell you a little bit about Mr. Smith. This is his wife, Mrs. Smith.
Alright.
He's here for a recurrent UTI. We're treating him with antibiotics right now, and I just want to show you his line really quick. We got running Zosyn, and then this one's almost done, and his next dose will be due in 4 hours. I just had the worst day. I mean, that was so embarrassing. I came back and my patient is climbing up the walls. I mean, thank goodness we did bedside so that we could get it all together. And then here are our references.